Welcome to Southern Caregiver Research Center. We're going to be talking about long-term care planning. I'm Marta Ranon, and it's really great to see so many of you here today. To our friends online, feel free to ask any questions or to check back for other topics. There is a list of other topics that we have covered, so feel free to check those out and share them with friends. And then, of course, at the end, we'll give you more information on our services as well as our contact information. And feel free, like I said, to ask any questions and get connected to our services. So we're all here because we want to talk about long-term planning. And it's something that a lot of caregivers, I think, and myself included as a caregiver once, that maybe we don't think about initially when we're caring for our loved ones. But then as we progress in our journey, of our caregiving journey, things start happening and we start asking ourselves questions, and sometimes we don't know unless we are right in front of that issue. So this is really good for all of you to gather information, take notes. It's very general, but at least it gets you thinking. Feel free to jot down anything, and if you need paper, let us know. So let's get started because we do have a lot that I want to cover. And my objectives for today are really talk about why we need to plan for long-term care. I know you know why, but sometimes it's hard for us to think about certain aspects of this. Some factors that can be considered when you are planning, and then how to make those informed decisions regarding long-term care. And I really do want to give you a resource at the end for you to consider. All right, so we know we are living longer, right? There is a life expectancy that is different than what it used to be. And so with so many of us living longer, we are seeing a lot of those individuals being women who tend to be the caregivers, I think, as all of you know. We're also noticing that there is a larger group of people who are living longer that are 65 and older. And because of that, we're going to be really relying on family, on friends to kind of help us with those caregiving duties, or at least expecting them to do some of that job. So it is important for us to really also think about ourselves, not just the person that you are caring for, but really ourselves as we are planning for our loved ones. So here is a little graph that I wanted to show you. Look at this. Look at that just upward line of our life expectancy. So we really are going to see, I know some people have called it the silver tsunami. We are going to see a lot of families having these questions about long-term planning, and even multi-generations living together. You know, even though we're probably more disconnected than we were before in terms of geographic, you know, people living in other cities, we are still looking at a lot of the family unit helping each other, at least living in situations where there are multiple generations. So this is something I want you to think about. So we were just talking about retirement earlier, and we plan our retirement. We plan weddings. We plan projects, right? We plan vacations. But do we plan for long-term care? Probably not earlier in our lives, probably more now, like some of you are facing these questions. So it really needs to be part of our lifelong planning, and also understanding that sometimes it's going to change. So the ideal situation, and maybe you know this applies to you, maybe it doesn't, but for some caregivers who, let's say, are caring for their parents, you know, we're seeing a lot of our caregivers in that sandwich generation, caring for smaller children, caring for their parents, working at least 20 hours outside the home. So the ideal situation is that everybody already had this discussion. All the advanced healthcare directives are in place. Agents have been identified, life insurance purchased, and even the children, the adult children, have done the same. And I say it kind of, you know, say, oh, yes, this is the ideal situation, but it really isn't. Why do you think that is? Things change, and sometimes we don't even want to talk about it, right? We don't want to talk about for when we need long-term care, right? There's this idea that we're going to be living in the same forever, yes, and then living in the same state, the same health, the same mental health as we were maybe in our 20s and 40s, and it's really not realistic. The reality is that sometimes we're ill-equipped to plan because we don't have the resources. We don't have even the idea of where to go. It is also very stressful to think about that, right? I want to think about happy things. I want to think about retirement as going off on an island and just hanging out at the beach, not about, am I going to need dementia care, right? And then sometimes there is a lack of support. Mom, don't talk about that. No, don't worry about that. Right? We put it off. And sometimes it's frustrating. I don't know where to turn. Where do I begin? It's so daunting. Okay? And that's why, again, I'm so glad you're here, because together, well, if anything, before you leave today, at least you start thinking about where to go. Okay? So when you are caregiving, and I know some of you are caregivers, I know that when I was a caregiver, it was hard to even figure out, well, when do I step in? When is it time to really have this long-term care conversation? Sometimes we need to look for warning signs, and maybe we're not ready, but things are obvious. Maybe there is a sudden weight loss or weight gain. Maybe there are a lot of outdated medications that person keeps taking, and that shouldn't be the case. What is an obvious one that I'm thinking about that we've heard on the news with people who are maybe getting frail and elderly? Getting lost? Maybe not being able to get home after they get in the car and then they end up somewhere else, or even walking out the door and getting lost somewhere else. So those are things for us to really consider, right? Or maybe you are thinking, wow, I keep forgetting things. Maybe I need to have this conversation with my spouse, with my adult children. So it is important to determine what kind of care you want. Okay, and again, this can apply to you as the caregiver or the care receiver, the person you're caring for. So what are your needs? What are the other person's needs? Right? Because you might have different needs than the person you're caring for, right? Maybe that person is not ambulatory, but you are. So that's not your need, but that is the other person's need. What are some of the limitations to providing that care? Hey, we live upstairs, and that person that I'm caring for is in a wheelchair. I'm going to have to think about another housing option. Or maybe that person needs to live somewhere else because I can't, take him up the stairs. Figure out that when you need assistance, maybe with the driving or the bathing. And of course, your situation is very unique to you. But this is the time for you to start making notes. Okay, this is what my situation is like. What do you think you would need help with? Do all these apply? Or there something that's totally different? I know it's sometimes people is even living at home, and maybe that person, the caregiver, is working, so you can't leave that person by themselves. So you need some sort of date care. Okay, so. And this, again, this says parent, but that can be applied, again, to you or the care receiver. Where are you going to live? Believe it or not, I was just having this conversation with my friends on Sunday. And they were saying, okay, are you in your forever home? I don't think we're in our forever home, that my friend was saying. And I said, okay, so what does that mean? Well, we want to live in a place where it's easily accessible to walk to services, the hospital, the mall, you know, a pharmacy, the library, you know, whatever, the senior center, whatever it is, and public transportation. So that's good that they're thinking about it, but then that means that they're probably going to have to sell their house and move and find something else. And if you want to live in, I don't know, Solana Beach, you know, downtown, those are pricey places, right? So then is that, do you want to incur that cost? It's something for you to think about. Who's going to be your primary caregiver? Is it you? Is it someone else? Who would you like your primary caregiver to be for you? Maybe you're the primary caregiver for your spouse. Who's going to be the primary caregiver for you? Right? And then how are you going to involve others as part of your care team? Family, friends, health, you know, physicians. How are you going to execute that? You know, we all want to live at home. And that's actually one of our goals, is to help caregivers, you know, kind of keep their loved ones at home. But sometimes there are things that need to be assessed. Do you need handlebars? Do you have stairs? You know, is it cold where you live? Does it snow? Do you probably want a place that is warmer? I mean, we're lucky here in San Diego County, but you know, this is something to consider, especially if the adult children live in places where it's cold and they say, well, Mom, you can just come and live with us. Do you want to live over there where it's snowing? I wouldn't, but that's just me. So we need to consider that things are going to change, and nobody likes change, right? We're set in our ways, but we're also set in our home, right? We've lived there for many, many years, and we don't want to change. We are happy where we are, but we might have to consider that change. And what services will we be needing? So again, this is hard, right, for us to even think about everything we're going to need, because we might not need everything. But at least you know where those services are and where to go in case you need them. This is, to me, the most important part of what I do. You know, I really, it breaks my heart when people said, I wish I would have known about this. And now you know, it's too late. So I want to make sure that you at least have that what is out there. Check out think about, do a scan in your community. Is there a senior center? Is that important to you, right? A social setting. Is there a hospital nearby? Or do you live so isolated that you would have to drive 20 miles to see anyone, right? And those are communities that we have here, Alpine and, you know, kind of in the east. It's important to start having that conversation. Having that conversation with your family, with your friends, with yourself. How easy do you think that would be? Easy? Not so easy? For some people, yes. For some people, no. And it's true, right? Some people might be very willing to sit down at the dinner table and just have that conversation. Other people might need one-on-one. I got to tell you a story. I knew two nuns who were very good friends, and they worked together. And it was getting to the point that they were thinking, okay, well, we need to figure out our healthcare directives. They sat down one evening, had their meals together, and they just kind of went down a list and said, this is who I want, this is what I want, this is what I don't want. And they kind of were there to help and support each other. And I thought that was amazing. Because who does that, right? And we don't say, oh, let's have dinner so we can talk about, you know, our long-term care planning, right? But maybe it is something that we should do. Hey, let's plan this. Maybe you need a friend to help you do that, at least start that conversation. Okay, so when you're having the family meeting, which can or may not be easy, may or may not be, I don't know, understanding, they might not be that understanding of your wishes, figure out who should be there. You probably. But is the care receiver, the person that you're caring for, should that person be there? Should family members be there? Should friends? Or should neighbors? Who should be there? What is your concern? You know what? Dad is falling a lot. Dad is getting lost in the neighborhood. Dad keeps crashing his car into the fence. Those are concerns. Those are real concerns. And so then you may prepare an agenda. And I know that kind of sounds silly, right? But because sometimes family meetings can be very emotionally charged, having an agenda to help you keep on track and refocus the conversation can be good, right? If everybody starts saying, no, 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 you're exaggerating. Dad always drives like that. And then they start with the conversations. You can bring it back to like, okay, so here's the agenda. Here's the concerns, yeah? And then determine if you have a big family surrounding you or friends. They don't have to just be family, right? It is your network of support, whoever that is. You might determine who can help you with certain things. She is great at cooking, so she's going to help with the meal preparation. Okay? Sally is great at talking to doctors, so I think you should be the person who kind of coordinates all that. Right? Vidi is really good at entertaining. So she might be the person who kind of picks up activities so that we are, keep mentally stimulated, whatever it is. And people want to help that way. And that way when you tell them, okay, you want to help? Here's what you can help with. That could also be part of your family meeting. Now we're going to have a caregiver role meeting. Now we're going to have a doctor's meeting. I mean, you can really extract and go deeper within your meetings. So it's kind of like a framework for you to follow. Okay, so long-term care, what does that mean for you? I know we have some words here. But what is long-term care? To be honest, I had never really heard long-term care. I had never even thought about long-term care until I started working here, even when I was a caregiver. So what does that mean for you?
I think it has to do with maybe probably getting out of your normal house life to
A different housing situation? Okay.
Most likely you spend the rest of your life.
Okay. So different housing situation where you spend the rest of your life. Okay. You were going to say something?
How you get to the end of your life.
Okay. How do you get to your end of your life?
For the caregiver and the person.
For the caregiver and the person, yes. So it really can encompass a lot of different things. It could also mean, what is your daily living going to be like? What is your health services, providers? What is that going to mean? What is that going to look like? Are you going to involve now neurologists into the mix? How about finances? How are you going to pay for certain things? What is your family dynamics going to look like when you can't do certain things like eating or bathing? Who's going to help you with that, right? So these are all things to consider. And it really is a variety of services, all tailored to you. This is why it's so important for you to figure out what's best for you and your situation and the person that you're caring for, right? It's to meet your needs, your healthcare needs during a period of time. And it could be a short period of time or a long period of time. You said until the end of your life, but it could be maybe you're getting surgery and so it's going to be a temporary, I'm going to go live with my daughter and this is how it's going to be until I get better and then I come back to my house. That could also be part of your plan. So here are kind of a more defined term of what is long-term care. And this according to U.S. Senate Special Committee on Aging. And it says it's really not, this idea is not to cure a disease, but really to allow an individual to attain and maintain an optimal level of functioning. And if that functioning that you want to maintain is in your home, you can do that. It is also includes a wide array of medical, social, personal, and supportive services, right? So again, you're starting to gather what you need in case you lose some capacity of self-care or you acquire some sort of chronic disease or illness or disabling condition, right? We all think about this ideal scenario. We just, again, having the metabolism of a 20-year-old until the end, and you just go to sleep and not have to worry about anything. But that is not the reality. So what is going to be the plan? What is going to be the plan? Again, for you and for the person that you're caring for. Okay, so here's a checklist that I want to share with you. So again, figure out what services are available in your area. Now, we are really lucky. We live in San Diego County. There are a lot of services available. And even us who are here to serve the family caregiver, we are always coming across new services and new programs that can help our caregivers. So it's good to know, at least you know that we are here and that we are here to help you. Figure out your finances, right? Really, nobody's saying, okay, go get a second, third job. But what can you do within your means? What is available? Talk to your family about your plans, especially if they're going to be involved. Hey, I'm going to sell my house because that's how I'm going to pay for this long-term care. Just so you know, and you're not surprised that this is not going to stay within the family. I'm selling it because I need the financial stability. Figure out what resources are available that can help you. And then, of course, healthcare directives. If you don't have one already, make sure you talk to someone about getting that. And then remember, healthcare directives change. If the last time you had one was 7 years ago, it's probably time for you to update it. If you decided to, different things, you learned about different methods or different services, then you might want to include those in your healthcare directive. And share that with your agent and share that with the people who know about your directive. Okay, so who needs long-term care? I don't know about you, but the fact that we're all living longer and that we are all coming to terms with the fact that we are caregivers, we're probably going to need caregivers. And as such, we're going to need long-term care, right? More than 1 in 2 Americans turning 65 will need some sort of long-term care in their lifetime. Some sort. But only 1 in 5 have discussed that with a professional. Interesting, right? I mean, we are going to need this, but nobody's talking about this.
Is it fear? Out of fear?
Probably out of fear, or sometimes it's just the unknown, right? We don't know. And it's so overwhelming. Where do you start? So here is something that I want to share with you because I remember thinking about this, and there's just this idea that it's not going to be me. I've always been healthy. I've always, exercised. I'm not talking about me. I'm just giving you an example. So I'm not going to need long-term care. It's not going to be an issue. Don't worry about it. My mom did not need it. My grandmother did not need it. We were fine. Well, a healthy lifestyle means you will probably live a long life and need long-term care as you age. An unhealthy lifestyle means you are likely to get sick and need long-term care because of illness. That may or may not be true, right? Because we might live a long time and we might need long-term care, or we might live a long time in healthy life and we might not need it. I used to sometimes think about this. It's so interesting. Now it's all about eating fruits and vegetables, right? And eat a salad and eat your greens and, for all kinds of reasons, right? Greens and antioxidants. When I was caring for my great aunt and she was 98 when she died, her diet did not consist of greens. I think the most green I ever saw her eat was like a zucchini in a soup, like in a stew, and a carrot and a potato. And those are root vegetables, right? It's not a lettuce. It's not salad. And she lived to be 98. So it's really, you never know. So that's why I kind of put it here, that it's not a given. It's not a given. So caregiving and long-term care, and this is where a lot of you come in. So most long-term care is provided at a home by unpaid family members, right? And it's difficult to predict what we need. We talked about this already. And we have no idea how we're going to pay for it, right? So how much is it going to cost? And this is where we kind of start thinking about the numbers, right? Sometimes we think it's going to be relatively inexpensive, right? About $417 per month, when in 2016 it was $3,861 a month for in-home care. I don't know about you, but that's a lot. But you're not even factoring all the other stuff. Nursing home care. The median cost of nursing home care is about $97,000 a year. By 2037, it will be as high as $176,000. So how do we pay for that? That is crazy, right? Especially if you're retired. And then there's this idea that, well, I'm just going to save. I'm just going to save. And what we don't think about is those costs can add up, right, as we need more care. There's sometimes a tax liability if you take out funds. You're in a stressful situation. Maybe there's an emergency and you have to go to the doctor. The person you're caring for has to go to the hospital. That's an added financial strain. So what about you, right? If you're using all those funds to care for your care receiver, what about your needs? Are you going to end up with nothing? So there is this idea that Medicare is going to pay for it, right? And you laugh because I don't know how, but they don't cover long-term care, and it only covers a portion, especially if, like in a skilled nursing facility, it's only 100 days. So there is a limitation. Medicaid, which here in California is Medi-Cal, obviously there are some restrictions. And then some people say, well, I have my employer-sponsored health plan. Okay. And it's probably limited, right? If it's an employer-sponsored health plan and you are retired. So it's not necessarily a place that you can, or something that you can rely on. And I know we kind of joke that by the time we hit that age bracket, we're really not going to see any of this Medicare benefit for ourselves. So we really need to start thinking about this. So I really wanted to share this, and I'm not going to go into it, but I really want to share the types of coverage that there are, okay? And just so you become familiar as you talk to your financial planners or maybe your family members, right? Self-funding, right? You have the money to do that. Annuities, life insurance with long-term care combination, traditional long-term care insurance. What I would suggest, and this is what we're very lucky that we partner with Century Pacific, and we have someone who would be able to help you plan as specifically as it relates to long-term care planning. So if you're interested, make sure you connect with us afterwards. But this is something that they would go over to talk about what are your options based on your individual needs. And that's why I don't want to go into it, because I think everybody's needs are so different. But I just wanted to share some of those terms so that you can look more into that and ask those questions. Okay, so how do we access long-term care? So again, long-term care can be many things, right? It can be somebody caring for you at home, at a facility, out in the community. It's really a support system if you think about it. So long-term care insurance is part of your long-term care plan. So I really want you to think about the support system. You're probably going to combine, and maybe you start jotting down notes now. Who are your professional team members, right? Your doctors, nurses, physicians. How do you expand from there? Well, maybe you contact us, right? Southern Caregiver Resource Center. We focus on 100% on the caregiver. Maybe you take some classes like you're doing today to at least start thinking about these topics. Seek resources. Make a plan. It's an ongoing plan that you are making for yourself. And now we get to talk about some of the housing options, because I know this is very much in everybody's minds as we age. So the ideal is always aging in place. So I want you to take a look at your home right now. Just visually, mentally, take a look at your home. Could you live there as you age, as your needs change? I'm looking at my home right now and thinking I would need a ramp in the front because I have stairs. And even though I have a handrail, and I had installed it for my aunt, a big long rail because it kind of goes up the hill like this, if I were in a wheelchair, that's a little scary because it kind of goes all the way down to the street, right? There she goes, yeah. And then I would need some assistance to get up the stairs, even though it's about 4 steps to go into my home. And then if it's a wheelchair, you know, the little hallways are this big because it's a 1951 home, so it's very small. So really think about it. There are also retirement communities, residential care homes, independent living communities, and we're going to talk about each of them, okay? These are the SNFs, if you've heard, SNFs, dementia care communities, assisted living, in-home care, and veterans communities. Okay, so we're going to talk about each of these. Okay, so aging in place. So the ability to live in your home safely, independently, comfortably, regardless of your age and your income, right? It's your home. But can you live in there by yourself if you had to? Living at home is also something that your family needs to ask, right? Can mom and dad live at home as they age? Do they have neighbors who can kind of check in on them, right? Is the bus stop really far in case they need to go buy something? Are stores nearby? Does a person, is it feasible for them to live alone? Can you manage the person that you are living with? Think about this too. As caregivers, many times we forget about our own health because we're so focused on the person that we're caring for, right? If that person has dementia, for example, are we able to manage the dementia symptoms? If the person has mobility issues, are we able to lift them up? And then, of course, the role reversal, the emotional aspect of caregiving. You know, as spouses, and I just had a meeting this weekend where spouses who are caring for, you know, their significant others, their spouses, individuals, I should say, caring for their spouses, they were talking about the role reversal. They were saying, you know, I went from a wife to a mother. And then the husband went from, you know, a husband to, yeah, somebody that they have to take care of now. So that is hard, right? Because you've lost that relationship and now you're entering a new relationship. And it's really taxing on the caregiver, really taxing. So long-term care could mean staying at home, aging in place. I think that's, again, all of our ideals, but I really want you to consider this. Are there stairs getting challenging for you to climb? Is the person just eating a can of soup every day because they don't want to cook? I lived here for 40 years. No other place seems like home. And these are quotes like from caregivers that I have spoken with, and even on a personal level. That one, yeah, kind of rings a bell for me. You know, the person was so used to the wife making the dinners. And then all of a sudden, the husband's nutrition started, you know, just being reduced to a can of soup because he was used to the wife cooking. We also have retirement communities, and those are complexes usually designed for older adults who are generally able to care for themselves. And it's a community. So that's what's good, right? You have other people, there are services, there's socialization, there are activities. Some of them are beautiful. I've been to a couple here in the area. They are expensive, just something to consider. Board and care, right? It's also something that the residential homes where people have kind of rent their rooms. And again, this I found out when I was caring for my aunt when I was a caregiver. So it's just regular homes, and you might not even realize that they're regular homes, but they rent out the bedrooms, and they're really adapted for a small group of seniors. So almost think like, you know, your college days where you had all these roomies. So kind of the same idea, right? You have maybe 4 roommates and they all live together. Independent living communities. So again, this is where people might be a little bit more independent, but they realize that living at home by themselves might not be a good thing. And some independent living communities have different levels of care, right? They have the independent living community, and then something that's more like assisted, and then memory care. So a lot of those communities have that as a draw, because they can say, you know what, you can start off as independent living resident, and then as you need care, you can move to the next housing areas, and we will take care of all your needs throughout your longevity with us. So that's something also to consider, but again, comes with a price. The more help you need, the more expensive it is. Skilled nursing facilities. So again, I'm trying to define these because sometimes I think people use the wrong terminology and might be confused, but it's really a patient rehabilitation center. I remember when my aunt went to the hospital for a condition that she was released to a skilled nursing facility, and I thought, what? What is that? And it's really just you know, professionals working with you to train you to go back to the way that you were before you went to the hospital, right? So it's a lot of occupational therapy, a lot of physical assistance, and then it's also very temporary, and a lot of times Medicare does pay for that. But that's usually, again, after you're being rehabilitated for some reason, some reason that you went to the doctor for. Hospital. Dementia care community, as the term says, it is in a community that is designed to meet the needs for a person with Alzheimer's, dementia, or other types of memory, you know, cognitive impairment. So what's really good about these communities is that they have specialized trained nurses, right, to deal with dementia. They have a supervised system. Some of them are locked facilities, and I know that sounds kind of harsh, but it's for the protection of their residents, right? We don't want them wandering, especially if they have dementia. So sometimes families feel very safe sending their loved ones there because it's no longer something feasible for them to do at home if the person keeps leaving the house. Assisted living, again, we mentioned this, that you might need a little bit more help with some activities like healthcare, personal care. It's really to assist with your individual needs. And so this is good to really ask when you are visiting communities. What kind of services do you have? Maybe you are considering moving into an assisted living community or independent living that has assisted living there. So ask those questions. We have in-home care. So this is where I think a lot of our clients really focus on, and we work with a lot of in-home care agencies. They will come to your home and assist you with, let's say, bathing or cooking or whatever activities you need during the day. The person that you're caring for, let's say, or you. Now, there are about 500 in San Diego County. That's a lot for you to vet and figure out if they're fingerprinted and insurance and all of that. So we kind of take the guesswork out of it by partnering with some local in-home care facilities. And you can see those on our website. You can see those in our lobby. We have lists of in-home care facilities where you kind of don't have to worry about that because they work with us. So they're vetted, and you can just pick. And usually throughout San Diego County, some have specific services that others might not offer. It could be a language. You know, some of them offer Spanish, others might not. Maybe some of them offer transportation, others might not. So you might really think about, hey, I cannot bathe my husband, so I need somebody to come into my home and help me do that. Now, what's really great about that is we do have a program that is called Together Care. And I don't know if you have a flyer here with you, but this program is great because we will pay for 50% of those services. And it's a new program that we're doing. So before you leave today, my colleague will give you a flyer, and it's called Together Care. And it also includes daycare facilities as well as some retirement services, retirement facilities. Okay, so they'll get you some flyers. And then, of course, we do have a program that's for military and veteran families. So we wanted to include the communities for veterans. And there are several veterans homes. I think you've heard them like that, veterans homes, throughout California. I know we have one here in the South Bay that's very close by, but they work very closely with the VA, Veterans Affairs Department, and I believe some of those benefits cover the fees. Others might not, I guess, depending on your pay, and you might have to supplement, but some are short-term and some are long-term. So again, if the person you're caring for, or if you yourself are a veteran, you might consider this as an option. Okay, so I know some of you are very familiar with our services, but if you're not, here is a brochure. Make sure you take that and look at everything that's available there. Again, everything we do is free. Everything is here tailored for the caregiver. We also have counseling services that can help you kind of figure out what to do with your situation. But especially today that we're talking about long-term care, I want you to write down our information because we have that financial planner who we work with very closely, who can help you answer your long-term care plans. And again, you know, we can help you set up that appointment. We also have legal and financial assistance. So some caregivers say, okay, so should I sell all of my assets to pay for this facility or this in-home care or whatever it is that you're considering? You might not have to. You might be able to access different services throughout the community. So before you make any rash decisions, make sure you set up a meeting so that you can talk to some of those attorneys. And again, we provide those initial consultations for free so that it takes away the burden. I just want you to know that it's for our clients, so just get connected to our services because we want to help you become a better informed caregiver and thus a better caregiver to the person that you're caring for. So any other questions? I know you probably have a lot more now that we've talked about this than before you came in, but that's good. That's good. Jot them down. Let us know. We'd be happy to you know, connect some of you today if you'd like. And our friends online, if you can just Google our website, scrc.care, check out all of our services. We also have other topics online and also information on the Together Care program, which is what I talked about today. And that concludes our presentation today. Thank you so much. Thank you.
There was one of the banks